Welcome to This Explainer. You know, if you're tuning in today, chances are you or maybe someone you really care about is dealing with some pretty frustrating spine issues. And honestly, you're probably just looking for some clear, straight answers. Well, that's exactly why I'm here. I want to give you real, unhurried, and precise information about what's actually going on in your back. Today, we're going to step entirely away from the panic and just look at the fascinating biology of what happens when a nerve gets compressed. Let's dive in. I want to start by addressing the elephant in the room right off the bat. Did I wait too long, and can my nerves still recover? Let me tell you, I hear this question more than almost any other. If you're dealing with leg pain, numbness, tingling, or weakness, you've probably already heard something really discouraging. Maybe somebody told you your MRI looked terrible, right? Or maybe you were told your nerve damage is probably permanent, or that you somehow missed your magic window for healing. Listen, you are absolutely not alone in carrying that heavy mix of fear, hope, and pure confusion. It is completely natural to feel like the calendar is suddenly dictating your entire fate. But I really want to reassure you right from the start. Modern spine research, it offers a reality that is far more hopeful and far more nuanced than just a simple ticking clock. Okay, so let's dive into the core of everything we're going to talk about today. For a long, long time, we've used this mechanical analogy for the spine. We tend to picture a pinched nerve as, well, just a squeezed electrical wire. But here's the thing. A nerve is definitely not a wire. It is living, breathing, biological tissue. It relies on blood flow, it relies on its surrounding environment, and it responds dynamically to any pressure put on it. Think about your lumbar nerve root, for example. This is a small but incredibly vital bundle of living fibers exiting your lower spine and traveling all the way down into your leg. Because it's living tissue, when it gets compressed, it doesn't just switch off like a severed cord. The pressure actually chokes off its microcirculation. It's literally suffocating the nerve. This creates swelling, it cuts off essential nutrients, and it actually bathes the nerve in inflammatory chemicals. And this brilliantly illustrates the two most common ways that this compression actually happens. On one side, you've got a herniated disc. This is when soft disc material pushes out. Now, it doesn't just physically press on the nerve. That material is highly chemically irritating. That triggers intense inflammation and that sharp, shooting, burning pain straight down your leg. On the other side, we have spinal stenosis. Now, this is a gradual narrowing of the space around the nerve, usually due to arthritis or thickened ligaments over time. It's basically a crowding issue, so that often feels more like a heaviness, cramping, or weakness in the legs that usually gets worse when you stand or walk around. So the absolutely crucial point here is understanding what surgery actually does for these conditions. Decompression surgery, whether we're talking about a microdiscectomy for a herniated disc or a laminectomy for stenosis, is designed to do one specific thing: remove the source of the pressure. Period. It creates a much better physical environment for the nerve. But, and this is key, it does not instantly heal the nerve itself. The nerve still has to do that on its own timeline. Let's look at how this builds over time, because honestly, this perfectly explains why healing takes so much patience. You see, nerve injury happens in distinct stages. It starts out with early irritation, where the nerve just swells and gets highly sensitive. If that compression keeps up, it leads to myelin injury. That's where the protective insulation around the nerve actually gets damaged. And finally, with severe or prolonged pressure, you get actual fiber injury, where the core nerve fibers themselves are physically compromised. Because of these different stages, your symptoms are going to heal at entirely different speeds. There was this fascinating 2014 study in the journal Spine that mapped this out perfectly. When pressure is finally removed, pain usually improves first, often quite rapidly. Why? Because inflammation calms down quickly, but numbness and weakness lag behind. That's because the larger sensory and motor fibers and their protective insulation literally take much longer to physically repair themselves. So if you have surgery and you still have some lingering tingling a few weeks later, it doesn't mean the surgery failed. It just means your biology is successfully taking its course. And that is a completely normal part of the whole process. Now, what's really interesting about this next point is this single fascinating measurement: 1 millimeter. Under favorable conditions, damaged nerve fibers regrow at a rate of roughly 1 millimeter per day. To put that into everyday perspective, that's roughly the exact same speed that your hair or your fingernails grow. I mean, think about that. This is a massive biological teaching point that every single spine patient should know. So why does that tiny little 1 millimeter matter so much? Because a lumbar nerve doesn't just sit there in your back. It has to communicate from your lower spine all the way down to your big toe. That is a distance of hundreds of millimeters. If a nerve fiber needs to physically regrow over that distance or rebuild its protective insulation millimeter by millimeter, it requires immense patience. We're talking about a process that takes months, sometimes up to a year or even more. Which brings us right back to that deep, nagging anxiety we started with at the beginning. If it takes this long to heal, what if I've already been hurting for years? Does the calendar strictly dictate my chances of getting better? Is it simply just too late for me? Well, listen to this highly reassuring reality. A 2019 study, again in the journal Spine, compared patients who had decompression surgery after having symptoms for less than a year against those who had dealt with symptoms for over a year. And the result? They found absolutely no significant difference in most clinical outcomes between the two groups. Meaningful recovery is very often still possible, even after a long, long time. The duration of your symptoms is a pattern, sure, but it is definitely not a personal verdict on your future. Time does matter, yes, but clinical factors matter so much more than just flipping through pages on a calendar. What really counts is how severe is the compression? What specific type of nerve injury is it? Is there profound weakness? How is the nerve functioning right now when a doctor does a physical exam? And perhaps most importantly, does your MRI actually match the symptoms you are feeling in your leg? These factors are the real, true indicators of your recovery potential. Now, as an educator, I must responsibly pause here for a moment because while chronic nerve compression is often a waiting game, there are moments it suddenly becomes an emergency. If you experience new or rapidly worsening weakness, a sudden foot drop, like where you literally can't lift your foot when walking, changes in your bowel or bladder function, or numbness in the saddle area where you'd sit on a bicycle, you must seek urgent medical care. Those are serious red flags that require immediate attention, no waiting around. It's also incredibly important to be completely honest about the limits of human biology. Decompression surgery is powerful, but it cannot magically reverse everything. If there has been severe, long-standing fiber loss, the body does have limits on what it can rebuild. Sometimes the nervous system itself gets hypersensitive from just being in pain for so long, a process we call central sensitization. And of course, surgery relieves pressure, but it doesn't make a 60-year-old spine 20 years old again. It doesn't just erase decades of arthritis. So recovery can sometimes be incomplete, and truly understanding that helps manage our expectations in a healthy way. But finding out your true potential, that requires the right kind of medical detective work. Look at the profound difference in this approach, right here from a patient's own perspective. They try to find the cause and treat that instead of just the symptoms. That is a stark, night and day contrast between a doctor who just reads a black and white MRI report to you and a specialized team that holistically listens to your suffering, physically examines you, and actively connects the dots to find the real root cause of your pain. And you know, this comprehensive approach is exactly what Dr. Kamal Woods and his team at Vertrae out in Miamisburg practice every day. Dr. Woods is a dual fellowship-trained neurosurgeon and spine surgeon. He specializes in minimally invasive techniques, sure, but much more importantly, he specializes in precisely matching your imaging, your symptoms, and your physical exam all together. It's like a giant puzzle, and the goal is to figure out exactly what is still reversible for you. So, I want to leave you with this final provocative thought. If you have been told that nothing more could be done, or that your so-called window has passed, but your quality of life is still really suffering, is it time for a fresh evaluation? Because not knowing your true options is definitely not the same as having a definitive answer. Please, don't let fear make the decision for you. Empower yourself to find out what is actually happening in your spine right now and what your biology is truly still capable of.